Good afternoon, everyone, and thank you for participating in this webinar. This is the fifth and last webinar that we are organizing for the for the EU-funded project Kidney Care. And today's webinar is titled "Teach Yourself Sustainable Kidney Care." So this webinar will present the revised sustainable kidney care online learning models. So for the project Kidney Care, we have developed a free course that addresses the critical connection between kidney healthcare and the environmental sustainability. So our intention is to empower healthcare professionals in nephrology to become leaders in sustainable transformation. And our speakers today are Stefi Barna and Furat Al-Murani from the Center of Sustainable Healthcare. So the floor is yours, Stefi and Furat. Thank you very much for organizing this webinar.
Thanks, Cesar. Lovely to be here. Thank you so much for facilitating this. Great to see both faces I recognize in attendance and also some new people. Elizabeth, thank you for putting your background, what you're interested in as well. I'm sure we are going to touch on that in this talk and how you can introduce sustainability at your clinic. And we also want this to be a starting point for relationships and contact moving forward. So we'll exchange our details at the end, and we do hope to keep in touch with people in here. Faisal, nice to see you in the room as well. I'm just going to share the content now. Okay, so as Cesar mentioned, our title is Teach Yourself Sustainable Kidney Care. The topics that we will cover in this talk are introducing a little bit about kidney care for those that aren't familiar, then launching the Sustainable Kidney Care module, which we're very excited about, and then lastly explaining a little bit about how to get involved. We do want this talk and webinar to be interactive. So if people have something that's on their mind or they want to ask or contribute, do just jump in, raise a hand, write it in chat, whatever you're comfortable with. And hopefully we can facilitate more of a discussion. So to begin at the start, what is kidney care? Well, kidney care is sustainable kidney care. It is a Horizon Europe funded project that aims to reduce emissions related to kidney care by 40% by 2030. And we are working with 4 partner sites located across Europe and divided by, so in the West, we have Utrecht in the Netherlands, and Eastern Europe, Warsaw in Poland, and in Southern Europe, Unimore in Modena, Italy, and Fundación Jiménez Díaz in Madrid, Spain. So the thinking behind 4 different contexts is to facilitate cross-learning, so we can see what works across different contexts, what can we replicate, and what is more context-specific. I'm sure people in the room know, but just in case and just to cover it again, because it is so important, and this is something I get asked often when I speak about this outside, is why kidney care? Well, we know that kidney disease affects 10% of people in Europe, and it's rising. Most people don't know that they have it, which means it generally progresses, and 2/3 of people are diagnosed late. So if untreated, it will progress to end-stage kidney disease, where people need dialysis or kidney replacement surgery. And now here is the crucial figure. End-stage kidney care has 18 times the carbon footprint of general medicine. So it's incredibly resource intensive. So to put this picture together, we have an increasing number of people with a condition that they don't know about that has a hugely disproportionate effect on the planet. This slide really is to just reinforce this idea that kidney care and climate change have a bidirectional relationship. So as climate change progresses and we get heat waves or more heat waves and droughts, we drive more people into acute kidney injury. We have more extreme weather events interrupting supply chains and care. And if this care were to involve dialysis, for example, then this is potentially catastrophic. At the same time, the emissions from a highly resource-intensive care pathway, and they're mainly due to supply chains and procurement, in turn drive climate change. So one drives the other, which drives the other, and we end up with quite a concerning flywheel effect. So kidney care will cover the following items in terms of how it will address this. But the focus for this talk is the training module. And these are for healthcare professionals, but also they are accessible to people of interest and the general public. Which brings us to the launch of the Sustainable Kidney Care online learning module. Now, this is super exciting for us because we are halfway through Kidney Care, a project from 2024 till 2028. And we're at a point now where we have captured learnings. Lots has been published and now is being integrated into the module. So in terms of what the module covers, we cover that bidirectional relationship between kidney care and climate change. And crucially, those that do the module will learn how to improve patient outcomes whilst reducing waste, pollution, and cost. So we think about improving outcomes for patients and the population while reducing financial, social, and environmental impacts. And if we look at audience, and this is something I think is so cool, is you see just how many specialities this course caters for. Because we know that care pathways are multidisciplinary, and so we have designed the module to also be multidisciplinary in terms of who can do the course and who will benefit from it. It's 1 hour to do the course, but that's if you do just the sort of basic reading. We have included lots of links to further materials, to videos, to papers, publications. And so really, if people want to dive deeper, they are able to. Currently, we are launching, as of today, in English, but the translations for Spanish, Italian, Polish, and Dutch, so our partner site languages, are currently in the works, and those will be launched very soon. So, as for the course itself, it's broken down into thematic, so bite-sized pieces, and we recognize that people learn differently. So how information is presented varies from text and graphics to charts and schematics, as well as the links so people can go to the original source and read more if they would like to. You're able to share your progress. So if you can't complete it in one turn, then it's very easy to save and come back. If you're like me and you like making notes while learning, then the course and the platform facilitates that as well. So if you look into the upper right corner of your screen, you can see where it says take note, or alternatively, you can highlight the text and then you are able to directly make a note. So for example, dialysis making up 2/3 of the carbon footprint of kidney care for me was something that when I learned that blew my mind, and I would want to make a note of that. And then what's really cool is after you make your note and you go back to the platform, it remains highlighted. So you're able to make your notes, leave the platform, log in again, and you can immediately see what it is you've highlighted, what your notes are, and carry on from where you left off. You can also make generic notes about a topic, which I think is really useful as well. Because we are giving a certificate at the end of the course, there is a quiz, and given away the answer for the second question, but I think people here would have known that anyway. And it's a really good way to just reinforce some of the learnings from the module. One of the reasons that for me, I think this course is so exciting is we're at the cutting edge of the research that is being conducted. So Horizon Europe is ongoing. There's almost 2 years left of it. And this is a living course. So we're including findings from studies and papers that were published even as recently as a few weeks, and they get updated into the course. So this is something that people can use and really be up to date with what is taking place. And the other reason it's so exciting is that by participating now, you'll be able to shape the final iteration of this module, scheduled for the end of kidney care, so late 2027. And that's really why at the start of this meeting, we want it to be so inclusive. We want to meet the people who will be using this, and we want to co-develop it. So Elizabeth, for example, who, you're wanting to introduce sustainability at your clinic, we would be delighted to have the conversations in terms of what it is that would be helpful for making that case to your clinic to introduce more sustainability. And so really we see this module as something that we will work with the people doing the module to shape it into something that is as useful as can be based on the most current and recent findings, studies, audits, and papers. I could pause there actually and see if there are any questions based on those sections. Feel free to put them in the chat or jump off of mute. Alternatively, we can have them at the end. Okay, I see nothing in chat. So how do you get involved based on what we've just said? Well, there are 2 ways. First way is the module, which we have just launched as of today, and we will give the link for that at the end of this talk. And the second way is to join the Kidney Care Sustainability Network. Now, for those that don't know, this is free. It's free to join. And it's the largest and most up-to-date peer-to-peer kidney care network. So we can see 688 members, events get posted, topics get posted. And what I find particularly useful are resources get posted. So we go to the resource tab, and then we can filter by resource type. And let's say I'm looking for an academic publication. And I can see there what's been posted recently. And I can also search by keyword if useful. So instead of going to Google, it's just a place that, in my opinion, brings together the very best work and resources into one place that are that's easy to find. And because it's peer-to-peer, you can engage directly with the authors, researchers, clinicians. So you can ask questions and have them answered by the people who published. So it's a fantastic resource that is updated constantly with a whole host of different resources. So I really encourage people, if you're not already a member, to sign up. The other reason that the networks is fantastic is you can see which events are coming up. So, for example, this Thursday at 2 o'clock London time, at the Centre for Sustainable Healthcare, we are hosting a fantastic patient expert-led webinar. And I'm sure people in the room would agree that when a webinar or a talk is being given by somebody with lived experience, it just takes on a new dimension and really brings those messages through. So here we have a dialysis patient who was sharing his experience of how switching to a plant-based diet has improved his experience of end-stage kidney disease. And to go back a couple of slides, this is all hosted within our networks page. So by signing up here, you get access to all the resources, as well as all the events, including our upcoming webinars as well. So that brings my introduction or contribution to a close. I would encourage everybody to scan those QR codes. The first is the Sustainable Kidney Care module, which we would really encourage people to do and to help co-create. So if there are things that we have missed or things that people would like more details on, my email's there and I would be delighted to hear directly from you. I'm really happy to keep those conversations going. And also to join and become a member of the peer network, because we're really building a community of practice and this community of excellence, people who work within kidney care, linking with others around the world for knowledge sharing, community, peer support. Yeah, so on that note, stop sharing. I almost ended your event, Cesar. That would have been a disaster. There we go. I would be happy to take any questions from those in the room.
Shall we stop there?
I could see that Elizabeth was typing. I'm not sure if a question is forthcoming or not.
Yeah.
Thanks for the kind words, Gareth. Elizabeth, how do you get people involved that are not big on sustainability? That's a really good question. Towards the end of the module, there is a section specifically for how to drive change within the workplace. And so obviously you're coming at it as a nephrologist who's interested in sustainability. So you're going to know a lot of the materials, and from the academic side, I think the start and the middle of the module you'll be very familiar with. But then I think that end of the module in terms of how to drive the change, and we cover different strategies of doing that. I don't know, Stefi, if that's something that we would want to touch upon here.
Well, I think, yeah, briefly, a lot of the model we're using takes the idea of the triple bottom line, which is very common in business, and applies it to healthcare. So normally the bottom line in financial accounting is you look at how good your patient outcomes are over how much it costs. So that's your healthcare value. And if we think about sustainable healthcare value, then we would say, let's think about how good the patient outcomes can be. And in the denominator, let's think about cost, environmental pollution, and social benefit or harm. So the triple bottom line is financial, environmental, and social. And what we've found is when people are not interested in the environmental argument, you can certainly make an argument that there are cost savings to sustainability interventions, sometimes very significant. And you can also have outcomes that improve patient care, the carers' quality of work, the quality of work of staff, nurses and technicians who are working with patients. So there are many ways to make healthcare more efficient, which happen to have an environmental benefit or a carbon reduction benefit. I think we've found that's the best way to make that argument.
Yeah, that's a really nice way of a framework. Everything comes back to the triple bottom line. Just as an example of that, last week I was at an event speaking to a hospital site manager, and we were talking about central acid delivery as an optimization, as a change that we can make in kidney care to make it more sustainable. And approaching it with that triple bottom line framework and finding out what it was that was most important to the person I was speaking to. So, and they weren't a clinician, and they weren't so interested in patient outcomes or population outcomes. They were interested in having fewer deliveries to the hospital because traffic is a nightmare. And so I think having the conversations and then finding out what their hook is, and I'm often asking myself this when I'm speaking with people, is what is their hook? And if I'm speaking to a clinician, then I know it's most likely to be patient outcomes, population outcomes. But if I'm speaking to a commissioner, then maybe they're more interested in cost savings, as Gareth put in the chat. In fact, I'll read that out. So a great comment that in his experience, every sustainability improvement also saves costs. And so, yeah, when engaging with business managers, that sort of being their hook. So, yeah, I find that having the conversations and finding out what it is that makes that person tick, and then framing the change through that lens.
I just wanted to add a quick point. In the past webinars, we have also analyzed some of the outputs of the optimizations that are being applied inside of the clinical sites that are part of the kidney care project. So until now, there are very good results of some of the optimizations that people can go and watch again the webinars the 4 webinars that we did. You can find all that information on our website at kidneycare.eu. But over there, you have also the results from the LCA that was done in the hospital from the University of Modena as well, and also some analysis especially regarding the cost, regarding the different optimizations they are trying to tackle inside of the clinical sites. So it has been quite interesting how these kind of like little actions as well, like the optimization that are being implemented inside of the clinical sites, are like proving to be effective, cost effective as well inside of the clinical sites.
Yeah, and I noticed some of the speakers as part of this webinar series were presenting on those things. So yeah, thank you, Cesar, for highlighting that. That's definitely, for those that haven't watched those, highly recommended. I'll also just pop my email in the chat. And so very happy to continue those conversations as well outside of this webinar. Right. Yeah. So for those that can't, I'll just read out the comment from Gareth. They had central asset delivery installed at 2 units and have removed 1 million kilograms of staff lifting per year. So a huge social, in terms of going back to the triple bottom line, so reducing the impact of financial impact, environmental impact, and social impact. I mean, that's just a huge difference in terms of staff well-being if they're not carrying that amount and taking that much out of their day, the time to do so. Faisal, we need to shift the sustainable kidney care to cost-effective sustainable kidney care. That's where the real dividend lies. Yeah, and it's framing something in those terms. Suddenly managers and people that hold the budget start listening more carefully. I completely agree.
I also wanted to jump in regarding what Elizabeth from the Netherlands, she was saying that she wants to introduce sustainability at her dialysis clinic. At this moment, we have open a call for applications that is part of the Kidney Care Project. And this call of applications, you can find it on the Kidney Care Project, that it's a way of inviting other clinical sites and hospitals and institutions to apply their optimizations inside of their institutions. So you can visit the site as well and go to the call for applications. That even though the deadline was a few days back, we are still open for everybody who is interested in applying those optimizations inside of the sites.
Excellent. Great to hear you applied to be a pilot site. That's awesome. Any other questions or comments?
All right, shall we end there, Cesar?
Yes, if there are not any more comments, there's something to add is that thank you very much for your participation. You can find them later on this video on our YouTube account. Also, you can find all of our information, the optimizations that are being applied, and also some very insightful data inside of our website, kitnicare.eu. And thank you, Stefi. Thank you, Furat, for organizing this webinar. And for the participants, this course will also be available on our website. So just like to keep also posted with the latest news, just go to kitnicare.eu. Thank you very much for everything. Thank you for being part of this project, Stefi, and Furat.
Thank you.
Bye-bye.